recommend Carrie Hyde, always here to help you guys and guide you through. But I need to use some really, really, really amazing veterinarians that can come on here and also help guide you. So tonight we have Dr. Cannizzaro. Dr. Cannizzaro, welcome.
Thank you so much for having me again. I can't tell you, I really appreciate it. And I love working with you, Carrie. So thank you for having me.
You appreciate it. Are you kidding me? She's all the way out in Florida, willing to come on this late to talk to us. And we'll probably start to see, if you look behind her, you'll start to see the sun go down.
It'll get darker and darker. I'm so sorry.
Get darker. Yeah, no, we'll start to see some darkness going on in there. So we appreciate you coming on so much to help us guide us through some of the stuff that is just we're navigating through so much information overload between Facebook and all the stuff that's going on there. And we have all these different veterinarians. So it's just a pleasure to have all of the vets that come on here. So I want to welcome all of our listeners as you guys are coming in. Dr. Cannizzaro and I will be talking about a couple of different things tonight. But as always, I want to make sure you know that you can type in your questions, ask any question that you want, and Dr. Cannizzaro will help guide you through some recommendations and some things that you can do. I have a lot of back talk, Lori. Is that me?
I don't hear it.
I have somebody in the back that I'm picking up a lot of back sound, but maybe Lori can help me with that. I don't know. I'm sure it's probably me. I don't know how to get rid of it, but maybe type it in and let me know, Lori, if you get a chance, what I'm doing wrong. It is me, she says.
You.
Of course, I don't know how to stop it, but anyway, I probably should have put my speakers up. I hope that's not annoying to anybody else. I'll just ignore it. So before the show, I always ask the veterinarians if there's anything they want to talk about, if there's anything burning that they want to get off their chest. It's funny because Dr. Cannizzaro, like all of them, always says, nope, let's talk about whatever you guys want to talk about because, they've been, Dr. Cannizzaro, how long have you been a veterinarian?
Since 1991. And 1991. And I got involved and interested in holistic medicine around 1993. And I took the International Veterinary Acupuncture course first, and then Dr. Richard Pitcairn's professional homeopathic course for veterinarians second. Then I learned about some adjusting chiropractic, and I learned about Chinese herbs, which you can see behind me. I learned about Chinese herbs around the same time that I was learning acupuncture. But most of what I do in my practice is homeopathic medicine. I find that it's the deepest and most healing modality on the planet, and it can treat, in my opinion, most ailments much more effectively in my experience. And since I do both, I feel pretty qualified to answer that. I also really pride myself in trying to communicate with my clients in a way that we can help them understand, since homeopathy is a very kind of different conversation. It's a very different way of thinking about diseases and ailments. And it also treats the underlying imbalance of chronic disease as opposed to band-aiding by using ear drugs and medications and oral pills for pain and inflammation, or oral pills for itching and allergies. And all of these medications come with side effects, which is a polite name for diseases the drug calls itself. And I know I've mentioned that on your podcast in the past before. And that is what prompted me to look into natural medicine, because I thought there must be a better way. One, the disease problems would continue to come back. Clients would get frustrated. I used the medication, as you said. My pet seemed to get better at first, but as soon as I stopped it, it came right back again. And I thought there's got to be a better way. So that started my journey of holistic medicine. And I am 100% homeopathic holistic. So I don't prescribe drug therapy. That doesn't mean I'll take a pet off of phenobarbital or Keppra, which are anticonvulsant medications. If they have severe seizure disorders and they're on these medications, I don't say, oh, we just stop that right away. Whether we're able to reduce those medications or completely eliminate them, once instituting homeopathic medicine, those are possibilities. But I don't want to give somebody the impression that anybody who comes to see me would just immediately stop all life-saving medications, whether it's heart medications that are keeping an animal alive or something like that.
Yeah, I think that's where why a lot of people, and I'm glad we're kind of getting the listeners familiar with you, because like I told you, I feel like it's been forever since I've talked to you. It just feels like so long. Most of the listeners know I had a lot going on, so it wasn't Dr. Canizero, it was me. But it's been such a long time. So I want to remind our listeners, as we start diving into some of this and talking more about the homeopathy that you do. And a lot of times people don't really understand the difference between, and I don't want to get too deep into it because I want to talk about a lot of the stuff we're going to be talking about, but a lot of times people don't understand the difference. They will think that if they go to a holistic veterinarian, they are also going to a homeopathic veterinarian, and you know that that's not true. So can
That's
you just
correct.
briefly explain the difference between holistic veterinarian and homeopathic veterinarian, and why the two are so important to work together?
I'm going to step back just a tiny bit here and say that holistic medicine is a large umbrella term for all holistic modalities. And that would include acupuncture, Chinese herbal medicine, Ayurvedic, homeopathy. Homeopathic medicine is one type of holistic medicine. The dilemma that we have, and I brought it up in your podcast before, but I think it's critically important to bring up here, is there are partially holistic veterinarians out there that are practicing acupuncture, spinal adjustment, better known as chiropractic, nutritional counseling, maybe dabbling with homeopathic medicines in a non-homeopathic way, and they call themselves holistic veterinarians. And they aren't really, if they're still promoting dental cleanings and vaccinations and flea and tick poisons. That should be a clue that you're really at an allopathic practice, which is a traditional medicine practice. I just don't like to use that word because it doesn't put homeopathic medicine on equal footing in terminology. And I think that that's a disservice to homeopathy. And if you're going to one of those partially holistic vets, you're going to get allopathic mind thinking and treatment and diagnostic sort of avenues, and you're still going to get a lot of band-aid treatments. In fact, they sort of treat their holistic modalities as kind of a second-class citizen in their practices. In other words, they might add some herbs to the steroids, or they might, add a supplement to the steroids, or, vaccination or something like that. But that's not holistic. That's not really looking at the animal holistically. It's using allopathic medicine alongside of natural medicine treatments, but not really relying on the natural medicine treatments for actual treatment of the ailment you're going in for. So you may as well consider them pretty much allopathic veterinarians as far as I'm concerned. A homeopathic veterinarian is actually treating the underlying imbalance of chronic disease in an animal. So in other words, if a pet is diagnosed allopathically with cancer, hyperthyroidism, hypothyroidism, many of your listeners are going to be very familiar with some of these terms, I'm sure. Those aren't the actual diseases we understand as a homeopathic veterinarian. They're a symptom of the disease. So are ear infections, cherry eye, inflamed gums, inflammatory bowel disease. They're symptoms of the underlying imbalance of chronic disease. Now, sometimes people come into my office, their eyes glaze over a little bit because they think, what the heck is that? It is so simple, it's almost kind of ridiculous. What your animal actually has is they're out of homeostasis, they're out of balance. And so a symptom has been able to overtake the health and vitality and balance of the individual, which creates a symptom. And so we don't just look to the immune system if an animal has cancer. You have to look at the entire animal, which is why I think homeopathic medicine is the most holistic, because it looks at the entire patient, mentally, physically, emotionally, and we look for causalities, like if there has been a death in the family and then the symptoms started, or the death of a favorite pet to that particular animal, and then a symptom started, or vaccination, a symptom started, using flea and tick poisons or dental cleaning, and a symptom started. So we'll look for causalities that give us an indication of what homeopathic medicine fits the entire totality of the patient, which there in turn will stimulate, once we give that homeopathic medicine, it stimulates a healing reaction in the patient to help restore balance to the best ability the patient can. Now, if you have severe pathology, end-stage disease, organ failures, homeopathy or any modality, allopathic, homeopathic, or otherwise, is not necessarily going to give an animal a new set of kidneys or a new heart. or a new liver. But I've got to tell you that the body's ability to and be stimulated to healing with homeopathy far exceeds what I've ever seen in any type of medicine, meaning that we know that tissues regenerate. We have to have enough time for those tissues to regenerate, to reverse a disease that's like a big snowball going down a mountain and gaining speed and getting larger and larger. So we have to stop that snowball and reverse it if we can, stabilize it. So homeopathic medicine is one of the few medicines that can cure. And if it can't cure, it may be able to slow the progression of disease. It may be able to slowly reverse some of the disease and some of the unpleasant symptoms that come along with those diseases. So I will talk to my clients about allopathic diagnoses so that we all understand what we're about. But it's critical that listeners understand that that diagnosis is a symptom. It's not really a disease. We have to treat the underlying imbalance of the ear infection, or you will never cure the ear infection. So using the ear drops, the steroids and antibiotics and antifungals orally in the ear, whatever, they're Band-Aids. They will kill the bugs, but it doesn't restore balance. It doesn't treat the reason the infection is there, or the reason the cherry eye is there, or the reason that your cat, eats your underwear. It doesn't treat any of those things. No matter how you want to approach it, except with homeopathic medicine that stimulates healing in an energetic fashion.
Yeah. It's, you mentioned about trying to find, you go to a holistic veterinarian and you think, oh, holistic means this. You're so right on when you say, I still see holistic veterinarians selling kibble and feeding, and, they're holistic and they're feeding kibble, but they're feeding the holistic kibble. And it's just, it's great. There's so many kibble out there now that say that it's holistic, or they have,
well, there's not that much difference between organic pretzels and pretzels. So if you have organic pretzels, at least they're using organic ingredients, but it doesn't make it more nutritious.
Right.
So if we have organic kibble or natural kibble, which really is a bane in my craw, first of all, kibble, I think, is pretty terrible food, period. Yeah. However, it's highly, highly processed. I mean, would you live on kibble? Would you live on a bag of, crunchy little biscuity, tiny little they're not even chewy, little biscuity things? I also want to say to your listeners that dry food doesn't clean an animal's teeth. That's a complete and utter myth. And dogs and cats largely will tear meat and their food off of bones or whatever, and then they largely swallow the pieces whole. And the large amount of digestion, it does start in the mouth, but not as critically as it starts in the mouth for omnivores or herbivores, vegetable eating or meat and vegetable eating types of individuals. So that's important to know, because there's just no way that kibble is going to do that. They largely eat it whole. So it never cleans their teeth. Yeah. Healthy diet will keep their teeth and gums in good health. And so will not doing things to damage and disturb the immune system, a large portion of which is in the gut. And guess what? The mouth is part of the gut, in case anybody didn't realize that. That's part of your digestive system. So, and I'm not trying to offend anybody, it's just that we treat the mouth with National Dental Week or whatever the heck it is. We treat that as some separate entity where we just clean the teeth and we magically get rid of disease in the mouth. That's another ridiculous myth as well. I mean, maybe the teeth will look pretty for a while, but if we don't fix the digestion, you will not fix the mouth, gum, oral disease, or whatever. It just won't get fixed.
That is one of the hardest things I struggle with. I do have a veterinarian that does non-anesthesia teeth cleaning, but I'm always saying, okay, now we have to fix the gut. Like, we can't just, and inevitably people will say, well, can't I just come back every 6 months? I'm like, I don't understand why you would want to do that. First, it's expensive. Why do you want to put your dog through that? Let's just change his diet and get his gut under control and not have to do this. Well, it's a really hard battle.
Even hand scale cleaning is a bit stressful for an animal.
Absolutely.
I mean, I do hand scale dental cleanings in my office, and some animals are not that bothered and some are very upset by it. I don't have a problem with hand scale dental cleanings, but right to your point is that it's another Band-Aid approach. I don't mind doing it as kind of a first, okay, well, we'll just take these chunks of tartar off and whatnot. Right. But if we don't treat the entire individual, you're not tackling it. And I think that what you're speaking to are the people that just want the easy way. I just want to push, I just want to pour kibble in a bowl, and I can't be bothered. I don't want to do raw food. I don't want to do home cooked food. I don't want to do vegetarian diet. It's just too time consuming. I just want to pour the kibble in there. They're going to keep getting what they get. And more likely than not, they may be, just driving from McDonald's and Wendy's and, eating out a lot at restaurants. No offense to restaurants, but many of them, it's as much junk food as anything else. So, they may not be, even balanced meals for themselves that are healthy. And I get it. Our lives are very, very busy, but there are truly ways to do it. And I think the majority of my clients, I mean, I don't know, maybe people fib to me, but I don't think so. The majority of my clients are willing to do something in the direction of better nutrition. And better nutrition is going to be home prepared food where you can pick the ingredients yourself. And, you can control whether you're using organic and the quality of the ingredients you're using. And I recommend Dr. Pitcairn's recipes from his book, Natural Health for Dogs and Cats. And there are a lot of vegetarian and vegan recipes in there, which I strongly support for dogs. It doesn't work as well for cats, but he does have recipes for both dogs and cats. And that doesn't necessarily mean there's vegetarian recipes for cats. So ideally, home prepared food is best. Next best would be some of the things that you promote and sell. And again, there are some companies that will cater for organic foods. It's not easy to find. It's expensive to make for them. And really? I get that. I understand.
It is pretty expensive. So let's talk a little bit about, I want to talk a little bit about one of your favorite subjects, which would be bulldogs.
Oh, God. Well, you know that. I mean, I have, right, Pebbles? Pebbles, you want to come say hi? Come here, Pebbles. Come on, Pebs. Come on. Come say hi. Yeah, it's a good girl. Don't be shy. Don't be shy. Say hi, Pebbles.
Hi, Pebbles. I used to have a dog named Pebbles, but she was a golden retriever. So,
that was too.
Yeah, it was really weird. And this will lead into the other subject I want to talk about tonight. But we're going to talk about Cherry Eye and we're going to talk about Pica tonight. Mm-hmm. But I used to have a dog named Pebbles. I rescued her and she lived with my now husband, but we were dating at the time. And he had this little backyard that had a bunch of rocks in the backyard. And she, like day one, started eating them. And I thought, is that how she got her name? Because that's the name she came with. I didn't name her that. They named her Pebbles. And I think it was the first or second night, she vomited all these little pebbles out. And I thought, oh my gosh, they named this dog Pebbles because she eats pebbles. Like, it has to be.
Wow.
But she didn't.
So dangerous because she could get an obstruction.
Absolutely.
Expensive surgery.
Yeah, she stopped. I had, of course, changed her diet, so I don't know, I don't know, but she stopped doing it. She was doing it for the first couple of weeks that we had her, and then miraculously just stopped. So I shouldn't say miraculously because obviously diet changed or something had maybe her new environment she was in. I have no idea. So she was not very well taken care of when I got her. So whatever happened there. So, but I wanted to talk about bulldogs, particularly, not that they're the only breed that gets Cherry Eye, but I actually have a client who I was speaking with today, and he asked me what I thought about having his Cherry Eye removed of his bulldog. And I said, it's been a long time since I have worked in vet hospitals. So, and then I remembered I was speaking to you tonight. I said, that's a good topic. Let's talk about Cherry Eye, where it comes from, what it is, how it happens, just whatever. I know you have bulldogs, so I was like, it's just a conversation.
None of my personal bulldogs have had Cherry Eye, but that could be because they're on good nutrition and they're treated homeopathically. Or maybe I'm just lucky. I mean, it could be any of those things. Cherry Eye is kind of a common name. It really got its name because the gland pops out and looks a little like a red cherry hanging out at the eye, in the corner of the eye. What it is that there is a gland that secretes your tears, and that lives deep underneath the third eyelid of the dog. And on occasion, that will pop out. Typically what happens, we understand it in allopathic medicine as often being an autoimmune problem. And that alone should tell you something. Because if it's I have seen it pop out after animals have gotten vaccinated, for example. That can cause autoimmune disturbance in animals, sometimes in ways you don't really think about. But Cherry Eye could certainly be one of them. And I have seen that. Sometimes it'll happen independent of just getting a vaccination. But the gland will get swollen or inflamed. and then it will pop out. And it dries out. It can cause dry eye of the affected eye because you have an inflammation of that secretory gland that helps to produce tears to lubricate the eye. And if you remove that gland, which is a terrible idea, then you've just removed a large part, not all of it, but a large part of the production of tears. And so the best method, if you're going to do allopathic, is to have it tacked back down again surgically, and to preserve the gland. And usually steroid drops are used and all that kind of thing too, to try to reduce the swelling of the gland. I have seen homeopathic medicine treatment, if they've been worked up homeopathically, to find the right fit homeopathic medicine. Homeopathic medicine isn't like, well, if you have cherry eye, you always use this particular homeopathic medicine. You have to work the patient up individually. There may be many, many, many homeopathic medicines that could treat cherry eye. And I've seen it successfully resolve without surgery with homeopathic treatment, even in bulldogs. And of course, they have eyes that are more protrusive. So that can increase the possibility because they just don't have a lot of depth in the socket of the eye.
Yeah. I've seen it in everything. I've seen it in cockers. I've seen it in so many breeds. I do see it a lot in the bulldogs. My own bulldog didn't have that, but I see it a lot pop up when dogs are, like, when we see it, they come in for boarding and they're playing and they're roughhousing and they're having a good time. And a lot of times that will pop their cherry eye out. So, and that's not stress related. I guess it's just from pressure. Maybe I don't know what causes that, but I see that a lot just from them playing. It goes away on its own.
Well, that does happen. Sometimes they'll slip back and forth.
Yeah.
So likely if they pop out during boarding, and I'm, not trying to save you from the universe, it's probably happened before that, that the person probably hasn't noticed. It may not. It could be the first time. But they're excited and they're playing. It's just like a person who's excited. Your blood pressure is up. And, you can have increased blood pressure, increased blood flow, to the head, eyes, whatever. I mean, there's nothing scientific. I'm just theorizing that could certainly be a component with the play and the excitement and increased blood pressure and, banging around with each other. I mean, who knows? But I will say that that's not average. Again, that would be a symptom of imbalance, because we all know that dogs don't play in roughhouse and pop a cherry eye out. That just doesn't happen every day. It'll happen to certain dogs. And just like some people, my dad, he had plenty of ailments in his lifetime, but he never had headaches. And I, as a kid, had migraines, and my dad never had headaches. It just wasn't an area of weakness for him. Where, some dogs are not going to have an area of weakness with the eyes, that they would get cherry eye. But they might get chronic ear infections, or they might have, periodic diarrhea or food sensitivities. So just to give you an idea that, we may see breeds that are more predisposed to a particular condition, but it doesn't make it normal or average. And in my practice, I almost never use the word normal, because there's no such thing as normal. So I always use the word average, because we have a range of what to expect. So an imbalance would be characterized by anything that is too much or too little. And if you have a cherry eye that pops out, I mean, that's, who does that? They shouldn't have a cherry eye that pops out. There's something not right there. So there's an imbalance. Too excitable. Some dogs that I say that there are dogs that have ADHD, attention deficit disorder, and hyperactivity. And it's very difficult to train them, because you can't keep their focus and attention very well. That's an imbalance. And I'm not talking about puppies that are wild and a bit crazy and, and they progress in their training. I'm talking about the ones that you've had for like a year and you're still struggling to train them. They're still jumping on people. They're mouthy. They're wild. They fly and bang against the door when somebody rings the doorbell and comes in, and you just can't even control them. And you have to maybe put them in another room or in a kennel, because unless you leash them, they're just going to be all over that person. And that doesn't mean the dog is aggressive, but that wouldn't be average. That's too much. I mean, if you think about a child behaving that way, you'd think, oh my gosh, what's wrong? We shouldn't expect that well, this dog is just hyper. You don't worry about that. It's just normal for that dog. It's not. It's not average. We know that's not average. Or a dog that is hiding all the time, or very antisocial and very uncomfortable with, people and company. And I'm not saying every dog has to be the life of the party. That's not necessary. We're going to have a range. That's what I mean by average. So you can have ones that are a little bit more shy and ones that are super outgoing and the life of the party. And then you have outside of that, the ones that are cowering behind you. And those are imbalances. And the ones that have ADHD, and you have a terrible time trying to, get their attention.
Right. So as we're talking more about cherry eye, have you ever seen cherry eye cause any kind of vision problems, or has it ever if left alone, if no one does anything about the cherry eye and it comes in and comes out, have you seen it ever lead to any more serious problems, or do you think cherry eye is a serious problem?
That's a hard question to answer because, again, there's going to be averages and variations. The
Sure.
problem with a recurrent cherry eye is that can cause inflammation of the cornea or the clear part of the eye. It could potentially cause excessive dry eye, which could lead to inflammation of the cornea, clouding of the cornea, or even corneal ulceration if the eye gets too dry. If it pops in and out, that's always better than if it pops out and stays out, because then the gland is just not even going to be able to function properly to produce tears. It's not a serious condition unto itself. It's just that down the road it could lead to more trouble. But think of it this way, and I think this is the hardest concept for new patients, new clients to get. If we're thinking about a symptom like that, it's not so much that a symptom like that might be serious, but if we don't address it, we've never addressed the underlying imbalance. So what else is going to happen?
Right.
What else aside from the allopathic conversation I just had a moment ago, well, it could lead to dry eye and ulcers and all that, cloudiness of the cornea, etc. It's pretty rare they would lose their eye over it. Let's put it that way, especially if somebody didn't ignore it. If, the dog was getting a corneal ulcer, or cats don't usually get cherry eye. That's pretty unusual.
I've never seen a cat with cherry eye.
Well, their eye conformation is quite different than a dog. Yeah. No, I don't think I've ever seen one in a cat. I suppose it could happen because they have a gland too. Right. And the third eyelid gland, they have one as well. But no, it's pretty rare, but it's a conformation of the eye, essentially. I think the third eyelid is a bit looser in the dog, and certainly in some breeds as well, like cockers and stuff, they have a bit of droopy eyes. But some of that is underlying imbalance in breeding, not necessarily good breeding. So if you don't address the underlying imbalance, then that never gets addressed. And so you didn't fix the underlying imbalance, and something else could come along, maybe a digestive problem or a liver problem. And at the risk of jumping around some, the eyes in Chinese medicine are governed by the liver. They're also somewhat governed by the kidney. So what if we just ignore the eye, and then later on we have liver enzymes and some kind of liver problem? You see what I'm saying? So it's not
absolutely
in allopathic medicine. They don't look at things this way. They say, well, we'll just cut it out, or we'll tack the cherry eye down and you're done and your dog is fixed. No, they're not, because you didn't treat the reason, the causation for the cherry eye to pop out to begin with. Just because you tacked it down, or you tacked a dog that has bloat, and you tack the stomach either prophylactically, which means preventatively, which I totally disagree with in certain breeds, or even if they did bloat and maybe you twist and tack it, you didn't fix that. It's right. Another Band-Aid where all we did was affix the stomach to the body wall to help prevent it from rising and flipping in the, which is a deadly disease. But you didn't fix the cause of that happening. And a lot of that is digestion. Same thing with pica. Let's say your pet wants to eat tissues all the time, but it's really not a problem because I put my tissues away, or I put my clothing away, and so I don't have a problem. It's kind of like a person being allergic to strawberries. As long as they avoid strawberries, they're fine. They're not fine. You're avoiding the thing that shows the evidence of the symptom, and I'm not suggesting you should eat a strawberry if you're violently allergic and might die.
Right.
But you didn't fix anything. You just avoided it, or picked the things up, or put your tissues high enough that your pet couldn't get to them, or whatever the case be, or your trash can up. And dogs are trash can raiders, so I don't want to suggest that that's something that's an imbalance. But I'm talking about the ones that are seeking things out. I mean, on a mission, seeking things out. That's different than a dog raiding trash and checking out some tissues and sniffing them and chewing them up and making a mess in your house. That's different.
Yeah, seeking them out. We're going to talk about pica for sure. But going back when I was, million years ago, it seems like now, they would do surgery for the cherry eye, but I would say 50% of them were what an allopathic veterinarian would say was successful, because the cherry eye wouldn't come back, but they weren't all successful. I mean, one of my groomers right now, she had surgery done for one of her dogs quite a few years back, actually. And her dog still gets cherry eye. So it was completely unsuccessful. Has there been new, better treatments for it? Do you recommend doing that at all?
I recommend homeopathic medicine. Remember that even if we do a surgery, like I said before, you didn't fix the cherry eye.
Sure.
Just because we tack it down doesn't mean that if the disease is strong enough, it'll just manifest again. So if the imbalance is strong enough, you'll get the same symptom back again, which actually is an indication that the patient might be healthier when that happens. Even though you got that symptom back again, like if you cut a tumor off and it comes back in the same location as opposed to metastasizing, that would be a better, stronger, more positive reaction than if you cut a tumor off and now suddenly, there's cancer in every organ in the system. So I'm not surprised. I mean, when we call successes, what are we really talking about? I mean, a successful surgery, just because we tack the eye down or tack the stomach in a dog with, that might get bloat or has gotten bloat, it doesn't fix that underlying imbalance. So either something else somewhere else is going to happen, or the same thing is going to happen again. One or the other. It's just a matter of what and when. The point is that an animal that has ear infections, cherry eye, inflammatory bowel disease, this is really going to blow you away. It's all the same disease. It's not different. It's exactly the same disease. It's manifesting in this and this and this place. That's all. That imbalance, single imbalance in that patient is manifesting in those places. So
for that
pardon me? Go ahead.
Same imbalance. I understand what you're saying. It's just that this pet, it shows up as an ear infection. This pet, it shows up as diarrhea, but it's still an imbalance. Is that what you're saying?
Consideration all those symptoms. So a dog could have cherry eye, ear infection, and inflammatory bowel disease all in the same patient. Not flare all at the same time, but they're the same disease. But it's all of those symptoms that are as part of my workup to understand that case. You come in and you say, I'm just concerned about the cherry eye. I'm on special crappy prescription diet, and the inflammatory bowel disease, again, that's a Band-Aid, right? It didn't fix the underlying imbalance, which, an imbalance in the digestive system. It didn't fix that. It's avoiding the strawberries that you're allergic to, sort of. It's not exactly that same cascade of events in the GI, but it kind of gives you the same concept. But if they have a series of events either all together like that, symptoms all together, or individually, sequentially over a period of weeks or months or years, it's still the same imbalance. So the only way that we're going to resolve all of those imbalances, so we could fix the cherry eye and then the inflammatory bowel disease flares up. Or we could fix the cherry eye and then the ear infection flares up. We could fix the cherry eye with surgery and the cherry eye pops out again. To manifest any one of those ways is possible. Or
real quick, I just want to address go ahead.
But rarely do animals have one single symptom. That's rare. In their lifetime.
I agree with you. I think that a lot of times people aren't paying attention to what is the other symptoms. They only see one thing. And so it is important to understand there's so many other symptoms. I just really quickly wanted to just shout out to all of our listeners that are coming in, and I'm reading everything. And Melanie, you're exactly right. she's going back and talking about when you were talking about ADHD dogs. She's talking about how important the breeding is. I agree with you. I mean, sometimes, it goes all the way back, and training such an early stage. Thank you for putting that in there. So, so important. Christine,
training alone doesn't fix the ADHD. It is a perfect marriage between a really good trainer and a homeopathic vet, because training alone will help manage them, but it does not cure them. And the only thing I know that cures ADHD, can it be even cured? It usually can be at least improved, if not cured, with homeopathic medicine, is using homeopathic medicine and a really good trainer. So she's absolutely correct. I also want to say that that almost the number one reason for surrendering dogs to the shelter is conditions very similar to ADHD. People can't handle them. They're too much. They're this, they're that. And so this happens in mixed breeds. This is not just a pure breed problem. It is very common in mixed breeds, but I'm going to suggest to you that comes from mostly, but not entirely, the rabies vaccination. And that could be inherited in the lineage. You don't necessarily have to give a real-time rabies vaccination and see that, but I will guarantee you the rabies vaccine will make those ADHD dogs much worse. And a little bit of that in cats, but it manifests more as aggression and excitability to aggression. It manifests more that way in cats. In dogs, they aren't necessarily aggressive, although they could be, or they could be very mouthy. And I'm talking about, when you're trying to pet and they get so excited and they're grabbing your hands and they, scratching you. And, I'm not just talking about, a little bit happy to see you, but I think that your listeners are probably understanding what.
No, I think
somebody that has a dog like that, or might have a dog like that. And they are treatable.
Yeah, no, the rabies vaccine for sure. They're starting to do some more studies on it, but absolutely. I've seen dogs that I have taken care of for years, and they come in for grooming a couple weeks after they've had a rabies vaccine, and there it is, a whole different dog. Now he's aggressive. Now he's completely can't sit still. I've seen it so many times that I can't believe that there's not more studies on it. Although, if I really look at
it has been acknowledged in veterinary medicine, but it's sort of hidden and nobody really wants to talk about it. We do understand that with vaccinations, especially distemper and rabies, it can cause a post-vaccination encephalitis or meningoencephalitis. And meningitis or meningoencephalitis is an inflammation of the brain tissue, inflammation of the spinal cord. We know that happens allopathically, and yet nobody wants to talk about it. So if your dog has, sudden paralysis or sudden weakness after a rabies vaccine or something like that, or a behavioral change, it's weird to me that, oh no, that can't have anything to do with the rabies vaccination. Absolutely it can. And it doesn't have to happen in an immediate hypersensitivity sort of way. This could happen over the course of weeks or sometimes months. And I've treated many of those cases that have had major behavior changes after a rabies vaccination. To aggression. Dogs that previously were not aggressive. In fact, I think I have one of those dogs coming in who was a service dog to their child who's in a wheelchair and can no longer be a service dog because the dog has become aggressive. I don't know if it's after a vaccination because I don't have the medical records yet, and they're a new patient that just booked, so I haven't met them yet. But I'll be looking to see. Maybe they'd say it was after 6 months after the rabies vaccine, I think they said, but don't quote me on that. I can't remember exactly. I see a lot of patients. But that one's coming up in the next couple of weeks, starting to treat. And they're very frustrated because, their dog is totally different.
It's awful. I've seen it so many times that it's awful. And it's hard because I try to tell people, let's go back. What happened? What changed? Nothing. Let me see your records. Boom, there it is. Rabies vaccine. I'm like, here we go.
Yeah, once people see it, they get very angry, upset about it. Understand that what I tell people when I see a puppy is if I see an ADHD acting puppy, I warn them that this is a puppy that is probably going to be very sensitive to the rabies vaccination. We need to not do it, to be uber careful.
Yeah.
Give it once or give it at all or something like that. It's only and it's very sad get to bash the rabies vaccine 100%. Many dogs get a rabies vaccine is not going to change their personality or make them aggressive.
Oh no, we lost her. Christine, well, I'm sure Dr. Canizero will try to come back on. I lost her. But we're going to talk about Pica here in a minute with Dr. Canizero, because my own cat has that. I should say my husband's cat, and it's driving me crazy. When you say that it's driving you crazy, I absolutely understand 100% what you're saying. Lori, are you trying to get Dr. Canizero back? Just send me a little message. Let me know what's going on there. But yes, I have a kitten who I bottle fed. So I have had her from day one and bottle fed her. And I have no idea. It's absolutely driving me crazy. She is stalking my clothes. So my husband likes to say, well, pick up your stuff, this and that. But I'm really getting concerned that there's something seriously wrong with her, because it doesn't matter. At this point now, if she sees a little piece hanging out of my hamper, could you hear me, Dr. Canizero?
I could hear you. But yeah, we all like left the crime here for a little bit.
Yeah. So I don't know what happened here, but Christine had asked, one of our listeners has a cat who has pica as well as my cat. So I thought, yeah, let's start talking a little bit about this. My cat now here we have to know about my cat. Raw fed from day one, right? She's been bottle fed on raw goat's milk, raw unpasteurized goat's milk from day one. So she eats raw food. That's all she's ever eaten. She's never been kibble fed. Unfortunately, because I got her from the pound, they vaccinated her at a very young age and spayed her at a very young age. So there's not really, I couldn't do anything about it, but that's her history.
I have a lot of rescues, and they've been over vaccinated and spayed too early or spayed while they were in heat, all the bad things we could do as veterinarians.
Real quick, Christine, are you still there? It's just one of our listeners. If you're still there, type in. I just want to make sure, because I want to include your cat in what we're talking about. It'd be interesting to see if we have some similarities. So if you're still there, give us a little shout out. And but Dr. Canizero, what do you think about it? And is it seen more in cats than dogs? Because I have heard of it in dogs, but
both cats and dogs. Yeah. I think that it's dismissed more in dogs because dogs fetch sticks and, go pick stuff up. And we don't really expect cats to be picking things up. And don't get me wrong. I've had clients and friends who taught their cats how to fetch. So that can be done in cats, and they can walk on leashes and go for walks just like dogs. Yeah. Many people don't do that, but we sort of expect. We don't notice as much, if a dog is something we could consider mischievous, or maybe it was an accident, they ingested that. But in cats, you're going to notice it more because typically they're indoor cats, often not indoor outdoor. I think Christine asked a question about whether it was related to rabies vaccination. I can tell you yes. It is related to vaccinations. It's related to gut damage. And even if an animal or a person is on children get pica too. I don't know if you know that. I went to a conference one time, just going to digress a little bit. And this was astounding. A human homeopath was presenting a case of a child that was presented for pica. It was the most extreme form of pica that anybody had heard of. This child would actually eat the stuffing out of the sofa. I mean, all of the stuffing, to the point that the child was unable to defecate because they were so constipated and full of stuffing. And, it was severe. Obviously, that's severe. The child did get better with homeopathic treatment, but we know that most of our children are getting vaccinated. So I would suspect, and I don't know the child's diet because I don't think that was discussed, but if and otherwise acting normal, then there's no reason not to expect that pica should resolve. I think that was enough for it to resolve in your golden retriever. You can argue, some animals grow out of it. I don't see that as much that they grow out of it. I think there's a change that could cause, or homeopathic treatment is needed, because remember that pica is not a disease. It's a symptom of the underlying underlying imbalance. I know I'm going to sound like a broken record.
No, it is what it is. I'm glad to see Dr. Dim is working with you. I love Dr. Dim.
I'm glad that he is helping you with that. He is a homeopathic veterinarian.
Yeah, Dr. Dim's fabulous. So I was hoping that my cat would grow out of it. I was thinking, okay, maybe she's going to grow out of it.
It sounds too severe. Yeah, yours sounds too severe.
I mean, she is stalking me. I have noticed that lately she's really gravitating towards, I feed my dogs a lot more vegetables. My cats are really eating a lot of meat and bone, but I noticed like the particular cat that is having the problem, she is gravitating more towards grasses and sprouts. And so I'm going to increase that for her, hoping she's driving me crazy. Literally. I told my husband, and I love her. He's over here holding her right now and just like loving on her.
Aww.
And I told her, if she chews
that's
up
so she
one
won't
more,
go and eat all your clothing.
Yeah, exactly. I mean, I've seen her pull a little piece. I have like a wicker hamper, and I've seen her like try to pull it through the hole of my hamper to eat it. It's crazy.
Wow.
Yeah,
and it's dangerous. String foreign bodies and fabrics, and you could end up in surgery. And so it's a serious problem.
She hasn't had blockage yet. I'm so worried about it.
Well, I can totally. I mean, it's dangerous, and like I said, I've treated many of those. Most of them do get better. I would say probably the majority of them get better. Remember, you have to be patient too, because healing, I always tell people when they come to me, if you broke your leg, it's not like you go have surgery and then you can go play tennis tomorrow. So you need to think about it the same way when a patient and when a particular animal has an imbalance. It's not necessarily that we fix it overnight. It's a one and done. And not that it is in traditional medicine either. So people shouldn't get too excited. Things are so much longer with homeopathy. Some things are shorter, some things are longer. And with homeopathy, it depends on how much drug therapy the patient has had over a period of time, how much suppressive surgery they've had, how many dental cleanings, how many vaccinations. It depends on that, and it depends on the vitality and strength of the patient. And that really determines, and the depth of the disease. I mean, if an animal is that driven and that obsessed, that's pretty intense, but it doesn't mean that she may not respond pretty quickly to homeopathic treatment. That's assuming we come up with the right homeopathic medicine the first time. Doesn't always happen. Doesn't happen in allopathic medicine either. Sometimes they prescribe antibiotics that are just not correct and they don't fix the problem. And they go back and have to give a different medicine. So I don't want people to think, sometimes people say, oh, you're experimenting. Well, no more than if is giving antibiotics or steroids. It's not an experiment. We are selecting it like the right fit, although homeopathy is a better fit all the time. And if it isn't the right medicine, that is the purpose of our follow-ups, is to assess what did and didn't happen and to see if we need to go up in potency, make it stronger, change medicines altogether in the same way that you might even with allopathic treatment, although there's tons of limitations with allopathic treatment and it doesn't treat the underlying imbalance.
I think homeopathy, it's really quite sad. The expectations of homeopathy are there's so much more expectation from homeopathy than there is for allopathic, like you're saying. If you go to your doctor and he changes your antibiotics, you don't think much of it. But if you go to your homeopathic, but I think that also might come from the fact that by the time someone gets to homeopathy, they are so frustrated with allopathic that they have such high hopes that something different is going to work. And when then that doesn't work, they just say, oh, that just doesn't work. And it's really unfortunate because, I mean, as I'm learning more and more, talking with Dr. Pitcairn, Dr. Dim, Dr. Canizero, I mean, all of these really brilliant minds wouldn't be doing homeopathic treatment on so many animals if there weren't results. So I'm going to have to do a workup with you because she's driving me crazy. So we'll do that, and I'll keep you guys all posted. Christine, I'd like to hear about your cat too a little bit, but we'll have to do a workup. Yes. If so, I will consider adopting one of our Headbutt Hotel cats to local residents not far from her. Oh, does that say something to you? Headbutt Hotel cats to local resident.
I don't know. No, I'm not familiar.
Are you accepting? Okay, so she has. I see what you're saying. So, she says she wants to adopt a cat out from one of her hotels. There's a local resident that's not far from you. Are you still accepting patients so that she can recommend her to you?
Yes. Yes. Yes.
We lost her. We playing. My nonprofit is called Headbutt Hotel, and we're located She's in North Myrtle Beach.
I have clients that come from all over the state of Florida.
Okay.
I also have clients outside of Florida. I had a client come from Texas 2 weeks ago, and I often like to see them first if I can, to establish the client-patient relationship, and then we could do telephone appointments. So I always tell my clients I'm only ever a phone call away. So there's nothing the matter with working with a homeopath. Even if you don't work with me, if you find a path that's within so many hours of you, really it's worth it. I mean, go do the drive, go see that veterinarian, and know that we're only always a phone call away, because we can, if the veterinarian is willing, and not all homeopaths are, to do phone consultations. I do phone consultations nationwide.
That's awesome. So I am going to have to, normally Dr. Canizero and I can talk for 10 hours. We do a lot when we get on the phone with each other. But I'm going to because last week we tried to do a podcast with Dr. Josie Bug, but we had internet problems. So we're going to do a bonus one tonight. And she's going to be coming on for a little bit. So this is coming up our 1 hour. I know. So we're doing a little bonus one so we might be able to continue this.
Oh my gosh, you guys are lucky. lucky.
We are lucky just to have you help. Replying to Christine, the applicant lives there. My cats are 100% healthy and never vaccinated more than one time, hence my hesitation to adopt out of state. Oh, I understand. I love that you're doing your work on adopting these cats out, because it's just sad to see these animals so sick and people not going. So, which is why I just love that you'll come on here, Dr. Canizero, and help, and people can reach out to you, because we don't have enough homeopathic vets. They're not easy to find, guys. So please,
we aren't. And I implore you to do your research, because I do what I do because I sleep better at night. I feel better about what I do. My clients in general, the majority of my clients feel great about the experience that they have. You really have a relationship. It's a healing journey relationship with your homeopathic veterinarian, as opposed to coming in for 10 or 15 minutes with a partially holistic vet or an allopathic veterinarian. They can't wait to get you out of there, just give shots and a shot of steroids or whatever, and then you're on your way. And if there's a negative reaction, well, I don't know, we're busy, we can't see you yet, go to the ER. It's totally different. It doesn't mean that we're available 24/7, but I think the passion for healing, there's a totally different level of passion of healing with a homeopathic veterinarian. Make the trip. Work with a vet that's willing to do phone consultations if they're willing. I think that that's going to change in our future more favorably as time goes on, especially with COVID and what happened with COVID and whatnot. I just find a homeopathic veterinarian that you really like. And then, you may like one better than another. So you may want to work with somebody who's further from you. Don't be ashamed of that. It's a relationship, and you need to be comfortable with that relationship, whoever it is you work with.
I love that you said a passion for healing, because there is a difference. I have worked, the listeners know, I have worked for several veterinarians, none of them holistic or homeopathic in my career. And I don't think they had a passion for healing. I think they just had a passion for animals. They loved animals. Don't get me wrong. One of them, I don't think he liked animals, but most of them loved animals. But I have people that come,
I worked for a vet for animals.
I don't think he
years ago.
Yeah.
He was a good businessman,
but I think there is a huge animal. But there's a huge difference between loving animals and going to vet school and becoming a veterinarian and being smart, and all of those things I think are true, and having a passion for healing them. And like, I know I have that passion, because when dogs come to me with skin problems, I just want to get, like, I'll do it for free half the time because I want to see the results. It's so deep within me to now I know I'm going to get a bunch of phone calls. Carrie said she'd do it for free. There's only so many I can afford to do for free, but I have because it passionately, I want, I'm not afraid to say it. I don't know how do homeopathic vets who are opposed to rabies vaccines, for instance, tend to be anti-vaccines for people. Not necessarily. I don't know. What do you think?
I can't really answer that because that's an individual thing. People find different reasons for deciding to go with an experimental jab. I chose not to. I think it's a very individual decision. My mother-in-law wanted all the jabs. I and my own mother wanted all the jabs. So she went in all of the inoculations, and I won't call it a vaccination because it's really not. It's an experimental manipulation of your immune system. And, we have free will in this country, and I think we should continue to have free will. If you want to have a vaccination, do I think it's a good idea and healthy? Not necessarily, but there could be instances where it's not a bad idea for somebody. It's not really my job to tell that. What I am passionate about is a individual situation that's in front of me. I will give clients my opinion about the vaccine or any of the other ones if they ask me. I don't mind. But with animals, I want to see before me, am I going to recommend vaccinations much? A kitten or a foal? I do large animals and exotics too. Am I going to recommend that for any of the tiny animals? Probably not. There's probably going to be a circumstance, but if I have a client that insists and the animal is healthy enough to receive a puppy or kittenhood vaccine or something like that at the appropriate age, then I'll give it if they insist on that, as long as it's healthy enough. But I have to say that I can count on less than one how many times that happens in a year's time. But it happened. And I have given rabies vaccinations. I have certain clients that have insisted, and it is only if I've assessed the animal sufficiently healthy enough to receive it, and that the client knows there could be potential very negative side effects that could occur that I have no control over. And please, and you'll hear this on the web, that no problem, you can just give a homeopathic medicine, it'll reverse the negative effects of vaccinations. That is nonsense. And you may or may not. What you're doing is you're creating a chronic disease of imbalance that you're now asking me as a homeopath to try to fix with a homeopathic medicine. We may or may not be able to completely reverse what happens. So to rely on that and say, well, I'm not going to worry about it, I'll just give the vaccine, give food, those are homeopathic medicines. I'll give that and that'll be fine. It's not true. And if they are not homeopathic to the patient, don't feel symptoms, or the patient doesn't have any symptoms, or the animal doesn't have any, then they do nothing. And that is a misnomer out there that are misinformation that I think really, really important to correct, because you just don't get a pass. Say, well, I just can throw this homeopathic medicine. If I get a vaccination and the pet will be fine, the person will be fine. Get a COVID vaccine and they take food. Not necessarily. It may be homeopathic to their condition situation and do nothing. And they go on and have a very negative consequence. So that's a long answer to your question about vaccinations. Yeah. We're not all anti-vaccination. I am pro-health. I'm not really anti-something. I'm pro-health. What is healthiest for the patient, and what is the individual circumstance for which that individual is living? Are they animals under horrific control and might get attacked? That's pretty rare. Health with a rabies vaccine is we don't do it too many times. I think that's unreasonable.
Yeah. So I'm going to have to let you guys go. But Dr. Cannizzaro, as always, you are such a blessing to have in our corner of people, pet parents who are just trying so desperately to have animals live healthier lives. So I thank you always for signing up. She does this on her own free will, guys. So please contact her, reach out to her. She does consultations. Lori's given you all of the information that you need. And then, of course, we're here every Wednesday at 4:00. So Dr. Cannizzaro will be back on sometime. I'll try to keep you guys updated for it. Dr. Cannizzaro, I'm going to reach out to you so we can do a write-up on my cat. because I
yes,
can't
please.
stand this anymore. I will contact you within the next, well, I'm actually
very potentially dangerous, and she can't help.
I got to do something. Yeah. No, I definitely got to do that. So I will see you guys all later. And Dr. Cannizzaro, thank you
so much. I really appreciate it. And thank you, everyone who joined us. I hope that you got some valuable information. I look forward to seeing you again. Yes, really good question.
Yes.
So
great question.
Thank you.
All right, guys. I'll see you later. Actually, I'm going to be right back on here. Dr. Cannizzaro maybe wants to join us in our chat, but I'm going to be coming right back on with Dr. Josie Buke because you guys get a bonus episode tonight. And Dr. Cannizzaro. Yeah. So I'll see you guys in a few minutes. Dr. Cannizzaro, have a good evening.
Thank you. You too. Be blessed. Take care.
You too.